Hi, welcome to my second video. Today we're talking about colorectal cancer. That's right, big C. Everybody's scared about it, but we should know about it because according to Malaysian government statistics, colorectal cancer is the second most common cancer among all Malaysians. Unfortunately for men, it is the most common cancer, with 1 in every 56 Malaysian men getting colorectal cancer. It gets a little bit better for women, with 1 in 74. Now let's look at a little bit more detail according to the races. 1 in 82 Indian men and 1 in 91 Indian women will develop cancer. It gets a little bit better for Malay women, with 1 in 100, but Malay men fare worse, with 1 in 72. For the Malaysian Chinese, it gets worse, with 1 in 49 Chinese women and 1 in 39 men developing colorectal cancer. Now let's have a look where these cancers can develop. If we draw a picture of the colon, we can see that colorectal cancer can happen anywhere around the colon, right from the appendix all the way to the end of the rectum. Let's look at the different stages of a cancer. Initially, colorectal cancer usually starts with a small polyp which grows in size over time. And if it gets bigger and bigger and bigger, it may invade through the wall of the bowel, becoming a stage 2. Now remember that the blood vessels and the lymph nodes come together. Well, if the lymph nodes are involved, then it is a stage 3. From there, if it goes to the liver or the lungs, which are the 2 common organs, then it is known as a stage 4. Let's now move on to the risk factors. There are some risk factors that you just can't change. Old age and male, for example, is a risk factor. Secondly, processed meat. Eating processed meat is definitely unhealthy. Drinking excessive alcohol and being obese. Combining that with lack of exercise is a recipe for disaster. Also, cigarette smoking. So what are the common symptoms of colorectal cancer? Well, some symptoms are pretty obvious. Rectal bleeding and having abdominal pain or distension will make anyone rush to the hospital as quickly as they can. However, there are some danger signs such as changes in bowel habits which are a little bit more subtle. I think it is very important to note that everybody has different bowel habits. Some go more often than others, some have different consistency, but whatever it is, never compare yourself with your friends. Whatever the case may be, please go see your doctor as soon as you can. He will take a proper history, do a physical examination, and could probably take a blood test, arrange a colonoscopy, or even perhaps for a CT scan. A colonoscopy usually involves you getting admitted for the day, and the surgeon or the gastroenterologist will insert a flexible tube via your anus through your colon, where he is able to inspect the entirety of the bowel all the way to the appendix and sometimes into the last part of the small bowel. If he sees a tumor like this, then there is a high probability that depending on the site of the tumor, you might undergo a right hemicolectomy if it's on the right, a left hemicolectomy if it's on the left side of the colon, and if it involves the rectum, the surgery is called an anterior resection. These surgeries can either be done through the open technique of opening the abdomen through the midline, resulting in much bigger wounds, slower recovery, and more pain, like this, or doing multiple small incisions as in a keyhole surgery, where the surgeon puts a camera and operates via video, resulting in almost no scars at all. That's all I have for today. If you have any questions, you can email me, look up my Facebook or Instagram. I hope you enjoyed this video, and I look forward to see you again soon.